Intravenous fluid is divided in three forms, mainly hypotonic, isotonic, hypertonic. Hypotonic solution provides more water than electrolytes and it is diluting the extracellular fluid. The osmosis that will lead to the movement of water from the extracellular fluid to the intracellular fluid. After the osmotic equilibrium has been achieved, the intracellular compartment and the extracellular fluid have the same osmolality and both compartments will be expanded. So in a hypotonic solution, there will be a fluid shift from the ECF to ICF and after the shift, they become same osmolality and they together expanded. That is regarding the hypotonic solution. The examples for hypotonic solution is 0.45% NaCl or the half sodium chloride. Next, regarding the isotonic solution. Isotonic solutions, administration of this isotonic solution expands only extracellular fluid and there is no net loss or gain from the ICF. Intracellular fluid, there is no net loss or gain. An isotonic solution is the ideal fluid replacement for the patient with extracellular fluid volume deficit. Examples for isotonic fluid is Ringer solution and 0.9% NaCl and Ringer lactate solution, etc. So these all are the examples for the isotonic solution. Here the isotonic solution, they expand only the extracellular fluid and when there is a deficit in the extracellular fluid, the isotonic solutions are most suitable. Next one, hypertonic solution. Hypertonic solutions initially raises the osmolality of the extracellular fluid and expands it. So actually what is doing hypertonic solutions? Hypertonic solutions osmolality is expands. Extracellular fluid osmolality will be expands and it is useful for the treatment of hypovolemia and hyponatremia. And the examples for the hypertonic solutions are 3% sodium chloride. And it require the hypertonic solution. When we are administering hypertonic solutions, it require monitoring of blood pressure, lung sounds and serum sodium levels because there may be risk of intravascular fluid volume excess. So that's regarding the classification of intravenous fluids. It is hypertonic, isotonic and hypertonic. We can see the isotonic solutions first. Isotonic solutions. Isotonic solutions examples are normal saline, dextrose 5% in water, lactated Ringer solution. In normal saline solution, the osmolality is 308 milliosmolality per liter and it contains water, sodium and chloride. And the amount of sodium and the chloride is 154 ME equivalent per liter. And the uses of normal saline include it is a drug of choice for or the fluid of choice for the expansion of extracellular fluid volume. And in case of extracellular fluid volume deficit, this can be used. And this drug, it can be this fluid can be administered along with the blood products and it is used to replace large sodium losses such as burn and trauma in case there may be large amount of sodium losses. That time we can use the normal saline. Next one, dextrose 5% in water. The osmolality for dextrose 5% that is 252 milliosmolality per liter, and it contains water and glucose 50 gram per liter. Uses are initially isotonic and provides free water when dextrose is metabolized. So actually the dextrose 5% is isotonic solution, but when the dextrose is metabolized, that time it will become hypotonic. It expands extracellular fluid volume along with the expansion of intracellular fluid volume, and it is helpful in rehydrating and excretory purpose. And another use of this dextrose 5% is it is used to treat hypernatremia. The main caution is it should not be used for fluid resuscitation because of the hyperglycemia, and it should be avoided in clients risk of increased intracranial pressure. So that's regarding dextrose 5% in water. Next one, lactated ringer solution in 5% dextrose. The other names are lactated ringer, ringer lactate, Hartmann solution. Commonly we are saying Hartmann solution. The osmolality is 273 milliosmolality per liter, and it contains water, sodium, potassium, calcium, chloride, lactate. The sodium amount is 130 m equivalent per liter, potassium 4 m equivalent per liter, calcium 3 m equivalent per liter, chloride 109 m equivalent per liter, lactate 28 m equivalent per liter. The main uses of ringer lactate solution or lactated ringer solution is it is used to correct dehydration, sodium depletion, and replace GI tract fluid loss, and also useful in fluid losses caused by burns, fistula drainage, and trauma. Often administered for patients with metabolic acidosis because it's an alkalinizing solution. So, in ringer lactate, it can be given for nausea, vomiting, diarrhea, dehydration. All these cases we can give this ringer lactate. Then ringer solution means there is no lactate. The osmolality is same 273 milliosmolality per liter, and here the say almost same composition with the lactate ringer solution, but lactate is not there in ringer solution. So that's regarding the isotonic solution. These all are the examples for isotonic solution. That is, in this picture you can see sodium chloride, that is 0.9 percentage, and compound sodium lactate injection, that is ringer lactate, then DNS. Next is the hypotonic solution. Hypotonic solution, it is the main examples are a 0.5% sodium chloride, 0.3% sodium chloride, 0.25% sodium chloride, and 2.5% dextrose in water. These all are the main hypotonic solutions that can be used. The first hypotonic solution is sodium chloride 0.5%, that is 0.45% sodium chloride, otherwise known as half NS. The osmolality is 154 milliosmolality per liter. Water, the main contents are water and sodium and chloride. Sodium is 77 m equivalent per liter, chloride also 77 m equivalent per liter. And the main uses are used for replacing water in patients who have hypovolemia, hypernatremia. So that conditions we can give the 0.5% sodium chloride. So this sodium chloride that will treat the hypovolemia without increasing the sodium content. The main caution is The excessive use may leads to hyponatremia due to dilution of sodium. So excess use of half percent NS that may cause dilutional hyponatremia. Another hypotonic solution is 0.3% sodium chloride. Here, the other name is 5% dextrose in 0.33 sodium chloride. The osmolality is 365 milliosmolality per liter, and the contents are sodium 56 m equivalent per liter, chloride also 56 m equivalent per liter, glucose 50 gram per liter, and the calorie is 170 kilocalorie. The main uses are, it is used to allow kidneys to retain needed amount of water. Free water helps the kidney to eliminate solutes. Typically administered with dextrose to increase tonicity and used in caution for patients with heart failure. 0.225 sodium chloride solution. Here 5% dextrose in 0.255 sodium chloride. The osmolality is 77 milliosmolality per liter and it contains water, sodium, chloride and glucose. The sodium and chloride level will be 38 m equivalent per liter and glucose will be 50 gram per liter. The main uses of 0.25% sodium chloride is, it is the maintenance fluid for the pediatric patients, and it is administered with the dextrose in order to improve the tonicity. Next one, 2.5% dextrose in water. 2.5% dextrose in water. Here the osmolality is 126 milliosmolality per liter and the amount of glucose will be 25 gram per liter. It is used to treat dehydration and decrease the level of sodium and potassium, and it should not be administered with blood products as it can cause hemolysis of the red blood. So 2.5% dextrose in water mainly we are giving in order to treat the dehydration and the decrease the level of sodium and potassium, and it should not be administered with the blood products. So that's regarding the hypotonic solutions. This is the picture of half percent NS and it's a hypotonic solution. Next one is hypertonic solution. Hypertonic solution include hypertonic sodium chloride solution, dextrose 10%, dextrose 20%, dextrose 50% in water. Hypertonic solution, it contains 3% NaCl and 5% NaCl. Sodium, the contents of sodium in 3% NaCl, that is 513 me equivalent per liter. And chloride level also 513 me equivalent per liter. The osmolality is increased here. 1030 is the 1030 milliosmolality per liter. And the 5% NaCl, the sodium content is sodium contents is again increased, that is 855 m equivalent per liter. Chloride also same, that is 855 m equivalent per liter. The amount or milliosmolality per liter, that is 1710, that is 1710 is the milliosmolality per liter. Otherwise 1710 is the milliosmolality per liter. The main uses are, it is used for the acute treatment for severe hyponatremia and it should be cautiously given in order to reduce the occurrence of pulmonary edema. We have to give cautiously these hypertonic solutions. and it can be used along with the cerebral edema. It acts as a it helps to increase the diuresis. Some patients may need diuretic therapy to assist in fluid excretions. So all these conditions we can use this hypertonic solution. The main caution is, I already explained, that is in order to avoid the risk of pulmonary edema. Next one, if we give rapidly, it may increase the extracellular fluid volume. So that's regarding hypertonic sodium chloride. Next one, dextrose. Dextrose is 10%, 20%, and 50%. The osmolality is 505 milliosmolality per liter. Glucose is 100 gram per liter. Calorie is 380 kilocalorie. It is used in the treatment of ketosis of starvation and provides calorie and free water. Should be administered using a central line if possible, and it should not it do not infuses using same line as blood products are infused. The next one, dextrose 20%. Here the osmolality is 660 milliosmolality per liter. The glucose amount is 200 gram per liter. Dextrose 20% means 200 gram per liter, and it is used as an osmotic diuretic that causes fluid shift between various fluid compartments and promote diuresis. Next one, dextrose 50% in water. The osmolality is 2523 milliosmolality per liter. The glucose content is 500 gram per liter and used to treat severe hypoglycemia and administered rapidly via bolus. So this is regarding the hypertonic solution. Hypertonic solution include 3% NaCl, 5% NaCl, dextrose 10%, 20%, and 50%. Example for hypertonic solution, that is 3% NaCl. It can be available in small bottles and also as a big bottles. It is 100 ml bottle. This is the example for dextrose 10%. This is again an example for hypertonic solution, dextrose 25%. So these all are the classifications of fluids, intravenous fluids: hypertonic, isotonic, and hypertonic. Thank you.